think that most people just pretend that it's not relevant, it's not true, whatever, right? But it's a true thing. People do have mental illnesses, have mental problems, and we have to be aware of it, and everyone has to know. Like,
I think we probably need to get more teen groups together that are willing to go out into schools and talk about it more and more, like has been done a little bit here.
As a youth counselor, one of the things that I really believe in is availability and access to counseling and to someone, you know, trusted and safe to talk to.
I think a big part of mental health education and awareness comes from media. Our government's initiative to support people with mental health, and through giving teens specifically a voice in our community rather than ignoring what they have to say.
The big ones that I know about are child and youth mental health counseling, but which I know in Victoria, and I believe up here also, there's often a long wait list, and there's kind of some hurdles to jump to be able to get access to that counseling.
Like COS and the Child and Youth Mental Health Organization. That's all I really know.
Community Option Society, and I don't know any other services, to tell you the truth. No.
I know that some of the schools are on board with talking about mental health, and I know some in the Valley are not on board with talking about mental health. So for instance, we were discussing earlier about suicide, the issue in Suicide Awareness Week of that being avoided by some schools and the curriculum being changed.
My school does nothing at all, ever. And just having a pamphlet in the counseling office talking about mental health would help. They do nothing.
They don't really do much to help it at all. We don't know anything about it. I think we should learn more about mental health because I really don't know anything about it.
Yeah, I think schools should implement this more, because I was in school and I didn't learn about any of this. And I'm in university right now and I haven't learned anything about this, right? So it seems like people are just teaching me this now, and I never learned about this when I was a kid. So schools need to implement this, because I never had it, and now it's becoming more of a bigger issue nowadays, it seems, right?
What would be even cooler is to just have it a part of everyday curriculum, or in the halls, or just somewhere where it's just really normalized and, you know, just a lot of easy, accessible information, I think.
I think that there are a lot of gaps in services currently, just because of the pure numbers of youth in the schools. So not having enough counselors versus the student ratio, it means that the counselors can't themselves be able to meet the needs of all the students. So having more services available in the school, or support for the counselors to be able to do things like education on mental wellness, or set up supports if somebody is struggling that they can't manage within the school environment. And reducing the stigma comes from the way in which we treat people with mental health concerns.
By telling them that there actually is support and that they aren't crazy and stuff. And actually educate them on what mental health issues are, and if they have them, how they can actually get support for it.
Definitely have more workshops on the project. Definitely have, if they're willing, some youth that are willing to talk about their mental health issues with youth, so that they realize that it's a real problem and not an adult's problem.
I think having a lot more dialogue about it, it's kind of a hidden topic, it's a bit hush-hush, and so just having it more out there and in the open and not be something that people are afraid to talk about.
I guess just community awareness campaigns, maybe people where they access, so if people are accessing schools or community centers, places like that. In my experience, youth are really good with their phones, and so apps, or I get all these terms wrong, but different ways of communicating through internet and things like that.
I think, again, just really, it's about the sort of the youth helping to get the message out, and us supporting the youth to get the message out, whatever that looks like.
I think professionals should be involved as soon as there's any sort of issue that's cropping up. as far as intervention, but I think they should be involved as soon as possible for prevention. So help prevent kids from having any sort of mental health issues before they start.
Or if the youth address it themselves, so whatever age that would be. It might be as young as 8 or 7 or 6.
We worked with little preschool groups, so very young, talking about feelings and thoughts and ways of, expressing your feelings and dealing with difficult things. And so I would say the younger the better. And then, definitely going into adolescence, for sure. I feel like it's more about the situation and what the child or youth is facing, probably, than age. So if the support system that they have through family or school or friends isn't feeling like they can help the person, then I would say that would be a good time to seek help outside. I'd say, programs like I spoke to before that offer youth the opportunity to express themselves or have fun or maybe feel empowered or excited or engaged in something meaningful and something where it's just for the sake of being themselves.
Services that are helpful, I believe, are services that can be all-encompassing. So if you go somewhere, you're not turned away because you have a specific issue that's handled at another office. You can go and you can get whatever you need in that one location rather than being jumped around.
I think there's a lot of cool ways that we could start to just integrate it into life and into our conversations and into media. There could be maybe just more cool and accessible educational videos. I think just asking the questions and having the conversation, that's kind of the thing that I'm talking about, like for normalizing and for giving the chance to have those conversations in public spaces, maybe not just in counselors or school counselors or behind closed doors. Beyond that, seeing a private psychologist or psychiatrist, and which there can be a lot of barriers to being able to do that, especially financially.
Healthcare professionals have to change some of the ways that they address mental health with teens, because teens like to be active and they want to go for coffee, they want to sit in an office on a one-to-one. And also often they don't have transportation, so the ability to go to where the teen is to talk to them.
If we take away something that people can talk about, then what we're doing is we're putting shame to the issue. So unless we're open and aware of what's going on for people and we're allowing people to be human, then I think that we're never going to change the stigma around